My name is Tamitha Ratliff, NURB 461. This is my second movie analysis for the course. The movie I've reviewed is called The Doctor. It's a 1991 film directed by Randa Hayes. It's kind of based on a book published by Dr. Edward Rosenbaum called A Taste of My Own Medicine. The main character in the film is William Hurt. He plays Dr. Jack McKee. He's a very successful surgeon at a leading hospital where he lives. He's married and has a young son. Of course, being a surgeon with the long hours and everything, he rarely gets to see his family. Um, the movie is basically based on him, um, and it starts out, that he is dealing with patients, shows his colleagues. He doesn't have a very good bedside manner with his patients. Um, and most of those patients kind of are seriously, they're critically ill. Um, and his behavior and demeanor in the operating room is not very good either. He's kind of loud. He plays loud music, rock music. Um, most places do have music in the operating room. I worked as an OB nurse. We actually had music, but we tried to play low, soothing kind of instrumental type music to the patients. And it wasn't just that; it's just the calm to try to, actually to even decrease the noise background, background noise of the instruments and the machines and everything like that. But he plays it kind of loud. And some of the talk and everything between him and his partner is not really professional either. Um, he can be kind of rude, smart aleck kind of to some of them, some of the patients and some of his colleagues. I know one of the things in the movie that caught me. I guess one of the reasons it caught me is because I actually have a scar on my chest from I got burnt when I was younger, and he actually has a patient that has a scar on her chest, and she's mentioning to him that her and her husband aren't close anymore, and she kind of relates it that she thinks it's due to this scar and everything like that. Of course, his response was tell him that you're like a Playboy centerfold because you have she has the staple marks to prove it. Um, I was just kind of like, okay, taken back because that's rude. That's just completely rude. I mean, you know, sometimes we're self conscious. I know I'm 40 now, but before I was really self conscious, especially being younger. Even sometimes now, but I try not to let it bother me. But to say stuff like that is just, very insensitive. And, you know, people sometimes I don't think realize what they do say and how it can make people feel. As the story goes on, as it goes basically about him, him and his wife are out one evening at a dinner party, and they come home. He starts coughing really bad, coughing, big coughing spell. He starts coughing up blood, different like lung tissue and everything in the car. It kind of goes all over. Of course, he goes in to the doctors, have to be checked, everything like that. They take samples from like a tumor in his throat. Of course, a biopsy comes back that it's positive for cancer. Um, I've just lost my train of thought. I'm sorry. Positive for cancer. So as he starts going for further tests and more examination, more appointments, everything, he actually, gets to see what it's kind of like on the other side of the medical world as being the patient and not just the doctor. Um, he gets to see some of these displays of how doctors are acting, and they're not very supportive and things that they can say. Um, he has a clear understanding, we'll say, of how uninvolved and unemotional the doctors in the hospital people can be, and even his own staff, how they, you know, are like they don't care. He actually meets a lady. Her name is June when he's doing his treatments. and everything. She also has cancer. She actually has brain cancer. You know, they come very close, talk a lot, everything, and you know, she knows he's a doctor, things like that. She makes him promise that he'll never lie or mislead any of his patients again. That he'll be truthful, kind of, you know, make sure that, you know, you're caring. You got, you know, you see what it's like. We're here. We're kind of treated like numbers. You know, it's kind of, you know, very cold and everything. So she ends up actually passing away in the movie. You know, and it really changes him, and he remembers, and he, you know, what she said to him. He, you know, radiation, it doesn't stop the cancer in his vocal cords. It keeps growing. So he actually confronts one of his colleagues, and you know, asks him if he would perform surgery that he needed on his throat. Of course, they kind of didn't get along. He apologizes for any insulting behaviors and any comments he's ever made to him. This doctor, which is Dr. Eli Bloomfield, you know, his comment to Jack in the movie was, I've always wanted to slit your throat, and now I get the chance. So that just kind of goes to show you, kind of, I guess, his kind of stinky attitude and how he treated people was that people were wanting to slit his throat, and, you know, not literally, but now literally he's going to get to. So they kind of, you know, he realizes he's in the wrong. You know, like I said, he apologizes to this doctor. He ends up performing the surgery on Jack, which his cancer is treated, and he's eventually cured. And like I said, June dies, and that just changes his outlook on life, you know, and also his way he's treated with cancer. So when he returns to work, he actually begins to teach some new interns, and he teaches them about how important it is to showing compassion and being sensitive towards your patients. You know, he lets them know that, you know, he's been on the other end. He's been the patient, not just the doctor, and he's been that rude doctor that was very uncaring and insensitive, and, you know, he knows that he was in the wrong. So, you know, has these new interns, and he's trying to teach them to listen, show compassion, show your patients that you care, that you're there for them, listen to them. And in the end, you know, it'll make you a better doctor and a better person. One of the things that he does is that he ends up putting the new medical students, interns, in patient gowns. And he signs on various illnesses and orders all the tests for them. So they'll know what they're like. They'll experience these tests for real. They feel the real experience that they're soon, you know, when they graduate and they get out on their own, that they'll be ordering on their own patients, and that way they'll know what their patients are going through. He thinks that, you know, this will make them feel what it'll be like. Give them a little more, say, you know, I really know what you're going through because I've had some of these same tests. I know this one is really similar, I think, when I step back and look to the first movie I did, which was Patch Adams, because he also dealt with insensitive people. He actually had the insensitive professors when he was in school. He didn't like how they were cold and uncaring. I don't buy too many movies. I actually purchased this movie also, not realizing it when I went to look to see what I had for the second movie analysis. And after watching it and actually, you know, kind of jotting down what was in the movie and what I kind of wanted to say about it, I see how similar they are. So I'm not sure if that has anything to do with me becoming a nurse, which I think it does. I like to think it, hope it does, because I think actually, I know I had both of these movies before, because before I became a nurse, and that's one of the reasons that I wanted to be a nurse. I wanted to help people. Like I said, I had some burns when I was younger, and I had some really great nurses, and I had some really good doctors. I had some. Looking back, and you think about it, you're a child. I was 11, 12 years old. That they don't seem like they care, but I really had some really, really good ones, and I can remember them. I don't remember names, but I remember them. And they didn't just treat me like a patient. Some of them even came and would visit on their days off, or would bring, I can remember, and I still have quite a few of them, stuffed animals that they would bring me, or they would bring me in magazines, books, or little puzzles, or different things like that. Really showed that they cared. And I honestly, as I grew up and doing some of these classes and courses for nursing, you think back, well, what's, shaped your life and what's directed you in this direction, to pursue nursing. And I really think that me being burned is one of my things. And knowing and seeing that some of the people that I had was so caring that I wanted to do that. And I think that's why some of these movies, especially this and Patch Adams, when I watch them and I see that, how some people can be insensitive. And I don't want to say nothing's happened to them, but sometimes I think until you experience something, you don't know. You don't know what it's like, especially if you've never been the patient. Sometimes I think doctors and nurses, if you are the patient, whether it's after you become a doctor or a nurse or before, I think it helps you. I think it shapes you. And I think you know what it's like to be on that end, and you wouldn't want somebody just to ignore you and make rude comments. You want somebody that'll be there and that'll listen to you, and understand. And not everybody knows exactly what everybody's going through, sometimes, they say, I understand it, and they don't. And, and that's okay. But as long as they sit down and they take the time to listen to you, that's another thing that they really show that they care. I know I was a labor nurse for 10 years, and first probably 2 years of it, I had no children. And so, I try to tell the girls, it's okay, I understand, we're going to get through it. Really, I didn't. Until I had my first child, I didn't understand what some of them were going through. And then from there on out, I could say, I have a child, they're this old, or they're that age, or I have 2 children, and one's this and one's that. It's going to be okay. You're going to get through this. Yes, you're in pain now, but it's all going to be worth it in the end. So I really think that, showing the compassion and experiencing things in life, makes you a better person, and you understand, and you know to listen. And I know I've rattled, and I apologize. Sometimes I start talking and I can't stop. But that's my nursing or my movie review of the film The Doctor. Thank you.